Ladies and gentlemen, welcome to Mr. Kokosness's class. This afternoon, we'd like to look at low birth weight. So, low birth weight, we'd like to know what it is. Then, for your exam, what happens is that most of the questions on this topic will come in one-word answer, or at least maybe MCQ. So they try to do that. So you find this condition there. So they'll ask you one-word answer or cross-match or completion. That's why you find this. So what would they ask you for? They'll ask you for the definition sometimes, and also sometimes they'll try to go into the signs and symptoms so that you try and eliminate in terms of the causes. So they'll try to ask you in such a manner. So let's try to see what the definition is. So definition is that low birth weight is a unit with the weight of 2.5 or less, regardless of the gestational age or gestational period. So that's the definition. Okay, 2.5 or less. So that's the weight. So that's mostly the marker. Look at the weight, 2.5 or less. Okay, regardless of the gestational period. That's what you find even in your question papers. Okay, then let's look at the predisposing factors. So the predisposing factors, the first one we're looking at is maternal age. So under maternal age would have women or girls who are 16 or below 16 years of age, or those who are above 35 years of age. Okay, so that's the predisposed. Those are the two under age. Okay, less than 16 or more than 35 years. Then another one is a short maternal stature. Short maternal stature, we're looking at women who are short. So those who are short can give birth to a low birth weight baby. Then another predisposing factor is poor socioeconomic status. So poor socioeconomic status, we're looking at maybe say lack of income. Okay, so lack of income can lead to a lot of things, say shortage of food, poor environmental conditions, such. Okay. Another predisposing factor would be maternal diseases. Under maternal diseases, we're looking at maybe say the mother has hypertension. You know, hypertension, what it does is that it reduces the blood flow to the organs, such as the placenta. So the placenta will not have adequate amount of blood. So meaning that even the blood flow, so even the oxygen or the nutrients to the fetus will be compromised or reduced. So that's what we have. Another predisposing factor would be multiple pregnancies. So multiple pregnancies may mean that the uterus is carrying maybe say twins or triplets. So they'll be competing for space. Hence, they'll be ejected from the uterus, and they'll have a low birth weight, or they'll just be smaller while growing in the uterus because they're restricted. Then another predisposing factor would be smoking. Smoking, there will be a lot of carbon monoxide in the circulation, hence reducing the blood flow to the placenta. And then that will mean that the fetus will not have adequate amount of nutrients and oxygen. Okay, that's what it means. Another predisposing factor would be women who are addicted to drugs. So women who are addicted to drugs, the drugs can be heroin or morphine or even cocaine. So these can predispose because these affect the placenta. Another predisposing factor would be nutrition. So under nutrition, we're talking about shortage of food. So if a lady is starving or is not having adequate amount of food, you'd find that they restrict, the amount of nutrients this fetus will get, hence low birth weight. Then other conditions would be, say, fetal causes. Fetal causes would be maybe say a fetus is having an intrauterine infection, such as maybe say cytomegalovirus. So this will affect the growth of this fetus. Hence, this lady will give birth to a baby or a fetus, or just say an infant with a low birth weight. So that's what happens there. Let's look at the clinical features. When we look at the clinical features, what are some of the signs that you would see? Okay, this child has a low birth weight. So the first thing is that it will be visible. Okay, it will be visible, meaning that you see muscle wasting. meaning that this child is lacking subcutaneous tissue, meaning the fat. Okay, so you'll be able to see. So they lack subcutaneous tissue. The second point would be the skin is loose and dry, so it will be peeling off, okay, and they'll be having what we call spaced venic scasiosa. Okay, so that's what happens there. So those who are maybe advanced in the nursing field, they will know what venic scasiosa is. We're looking at the whitish or that whitish stuff that coats the baby's skin, so it will be spaced. Okay, so that's what we're looking at. Then the head has same proportion with the body, so the head will be of the same proportion as the body. That's the sign, okay, that this child has a low birth weight. Then the baby is more active and vigorous than the premature baby of the same weight. You see what I mean? Meaning that if it's a premature baby with this same weight, the premature baby will not be active, but then this baby is more active than the premature baby. So you'll be able to, so despite this baby being small, but it's active. So that's something that you'll be able to see. Okay, so now let's move on to what are some of the problems that affect these children with low birth weight. So some of the problems, meaning what will they go through? Number one, these children have asphyxia. So they may have asphyxia because we looked at oxygen. So if the mother is, say, having hypertension, or this lady is abusing drugs, we're looking at insufficient oxygen flow to the placenta, meaning that the fetus also will not have sufficient amount of oxygen. So the fetus will be hypoxic or have hypoxia, meaning this child will go into what we call asphyxia. So that's the first thing they will have as a problem. They are prone to asphyxia. Then another thing, or the second challenge or problem they might face, will be meconium aspiration. So under meconium aspiration, we're looking at that stool, the first stool that the fetus is supposed to produce. Now they'll produce that stool while in utero. So meaning that if they open bowels in utero, what's the problem? It means that the sphincters in the anal region, or the anal sphincters, have relaxed, and thereby stool will come out and it will go into the amniotic fluid. Then the fetus will swallow the stool. When the fetus swallows the stool, meaning they have aspirated meconium, and that is a problem because it will block, okay? It will block the airways. Then eventually, once that happens, you'd find that this child or this fetus will die in the uterus. And if it's during delivery, meaning that it will have an obstructed airway, so you have to suction and do all that, okay? So that's the second challenge, meconium aspiration. Third point is hypoglycemia. So we've learned that these are small and they lack subcutaneous tissue, and then these infants, you'd find that their organs are not even fully developed. Okay, so meaning that even the glycogen storage in the body will not be much. So they will go into hypoglycemia because even the glycogen storage is not mature. So most of the times they will go into hypoglycemia. So you need to really take or check their blood sugar because they'll go into hypoglycemia. Okay. Then another challenge would be infection. We know that their skin is mostly dry, sometimes it even peel off, and we know that skin is a barrier for infection. So they'll be prone to infection because the skin will be peeling off, and then that will be a source of infection or port of entry for infection. Okay, so that's what will happen. The skin will be peeled off, or it will be dry, creating a port of infection. So infection will be entering from there. Okay, so then what will also cause infection will be the meconium. If meconium goes on the skin, which is broken, it will cause infection there. Okay, another challenge will be poor temperature control. If you look at poor temperature control, earlier on I said they lack subcutaneous tissue, meaning that if they lack subcutaneous tissue, they will not be producing enough heat so they will go into hypothermia, so they will have poor temperature control. Okay, so those are the challenges that they might have. Then what are some of the investigations that you can do in terms of when you're doing management? So here, under low birth weight, in case it came as a condition and then you are writing it, they'll put the situation or a scenario for you. Could it be that it's an emergency or just maybe just general care? So what you're going to do is that they'll put one of the problems. In case they put hypoglycemia, as the child is born with a low birth weight with hypoglycemia or with asphyxia, then definitely you know that the child is having trouble breathing, and maybe hypoglycemia, the child is having issues to do with sugar, so you need resuscitation. That becomes an emergency. But it's low birth weight, but then those things when they come in, maybe if it's dyspnea, asphyxia, they mention something like that, or hypoglycemia, just know that you're talking about an emergency. So we need to start with resuscitation. So in future discussions, we'll talk about the things that you should include when you're looking at resuscitation, when you're looking at A, B, C, okay, so that you resuscitate properly, and then how you should write it. So if it's just general care, what you do is that if they've said write the management, okay, or just about just generally management, you need to start with the history, or maybe just the first of all investigations. Under investigations, you look at history, okay, physical examination, then labs. Okay, those are the things that you need to look at. If someone who can undergo maybe scan, you can put scan or X-ray. Depends with what you're writing. Okay, so that's what you do. So in terms of low birth weight, if they've said management, you can do history. So history, what you're going to do is that that's under investigations. History, you're going to look at maybe the mother. You need to ask the mother about the previous pregnancies, if she's been able to give birth to children with low birth weight. That's what you do. Okay. Then you also need to look at the history in terms of maybe maternal illnesses or even conditions such as preeclampsia or just hypertension or diabetes mellitus. You need to really ask. Then under lab, you need to look at need to get blood from the mother and test for syphilis. Okay, because you know that the child can be born with congenital syphilis and that can affect the baby. And you can also do blood slide to check for malaria, because malaria can also predispose to low birth weight, you know. So you need to do a blood slide. You can also do just a full blood count so that you rule out anemia. Okay. Another one that you can do is a random blood sugar so that you rule out hypoglycemia or hyperglycemia from the mother. Okay. Then any other thing that you need to do is that you need to give drugs. So if this baby is or fetus is with you, you need to check the blood sugar and then give need to give sugar, because you know that this child is prone to hypoglycemia, so you need to give dextrose, which is simply sugar. Okay, that's what you do. Then another issue is that they are prone to infections, so you need to choose an antibiotic that you can give. You can give amoxicillin. Okay, so you can choose maybe say 25 to 50 milligrams per kg body weight. So you can give amoxicillin in such a manner just for prevention of infection. Okay, then if you're writing the nursing management, then you come to the M's. What will you think of as your M's? So your M's, you look at to improve nutritional status, because you're looking at a child who is prone to hypoglycemia, so you need to improve the nutritional status. Another M should be to prevent infection. Okay, so that's what you do. Then the rest should be eprophenema. So we'll look at eprophenema alone so that you're able to know how to write it. So we need to write eprophenema clearly so that at least you put in the headings which should be there. So look at it as well so that you're able to learn how to write it. And I'm sure I posted some time back, a long time ago, I posted something to do with eprophenema, just general. Okay, so that's what you deal with under low birth weight. Okay, so let's try to go on and discuss some other topics so that we progress. Then we'll try to see how you can be writing your management. Thank you very much for watching.